Well, the Guardians is a consortium, and we are presenting data on first-line treatment with EV-Pembro in a cohort of patients with metastatic or locally advanced urothelial carcinoma. We have identified 272 patients, and of those, 80% of patients received EV plus Pembro prior to approval. So the patient's insurance companies would pay after we had the okay to do so. And of those patients, most of the patients had primary bladder cancer, 25% of the patients had upper tract disease, and I think of note, 20% of our patients had ECOG score 2 or higher, and approximately 60% of our patients were cisplatinum ineligible, mostly due to ECOG or kidney deficiency. So what we saw was that the median PFS was 13 months. The median OS was not reached. 57% of patients responded to the treatment, and approximately 70% of the patients had a disease control, 10% had a complete remission, and 14% of the patients had PD. Regarding toxicity, approximately 80% of patients had any grade toxicity. 1/3 of the patients had grade 3 or 4 toxicity. We observed no grade 5 toxicity. 40% of patients had immune-related adverse events, and 25% of patients received steroids. The toxicities we saw are pretty much what we expected. So around 40% of patients had PNP. We have a relatively short follow-up, so I think with time more patients will get polyneuropathy, most likely. We had 7% of pneumonitis at an adverse event of special interest, and another very common toxicity was fatigue and also dermatologic events.